How are you? I'm Paria and welcome to my channel. Okay, I hope that you are very well and today I decide to talk about the heart disease. Okay, and I'm will be happy if you subscribe this channel, like this video and write your comment. I'm waiting for your comment. So let's go. The first one, non-communicable disease. Okay, heart disease is the number one killer in our nation. Cancer is the number two, and the stroke is the number three. Okay, lifestyle. As you know, lifestyle is very important in life, and the lifestyle is a major factor that contributes to today's disease. Okay, and the next slide. And before I start the next slide, I will explain you about the lifestyle such as the eating, kind of exercise, and sleeping, okay, and extra. The next slide about the hypertension. Okay, and constant heart blood pressure 140 divide 90, and the normal blood pressure is 120 over 80. Okay, as you know, the hypertension is very dangerous in our life. Okay, and the force exerted by the blood against artery wall and known as the silent killer. Very little symptoms, but fortunately, easily treated. Okay. The next slide. A disease which progresses over time. Lifestyle and heredity play major role. Okay, and heredity is a factor which you cannot control. In addition to sex and age, such as exercise, smoking, high blood pressure, cholesterol level, stress, alcohol, and weight are factor you can control. So, the next slide about the high blood pressure. Okay, what causes it about the high blood pressure? The causes of high blood pressure can vary, and the most of the time, the causes isn't now. Okay, the next slide. The next disease I will talk about the atherosclerosis. Nerve artery due to plaque bored up by the cholesterol, fat, and other substances. LDL. LDL is the bad cholesterol that contributes to this increase on the artery wall, and the animal products such as meat, eggs, and the butter. Exercise lower LDL and increase the good cholesterol HDL. So, LDL is the bad cholesterol, but the HDL is the good cholesterol for the body. And as you see this picture, okay, the atherosclerosis, okay. And next slide. Okay, the hardening of the artery wall, which causes the artery wall to weaken and lose their elastic. Okay, as you see this picture, is the very bad disease about the heart disease. Okay, next slide. So, next disease. Next slide about the aneurysm. Bubbling of an artery, vein, or heart due to the weakening caused by disease, injury, or birth. If in the brain, it will cause stroke, and the abdominal aortic aneurysm is the most common of all aneurysm. As you see this picture about the aneurysm, and the aneurysm genetic play role, and smoking and high blood pressure may be underlying factor, and like the high blood pressure, aneurysm are potentially silent killer. So the next slide about the next disease. Thank you. The next slide about the stroke. A sudden and often severe attack caused by the insufficient supply of blood to part of the brain. Hypertension, atherosclerosis, embolus, thrombus are that are a factor which contribute to the stroke. Drugs and surgery are ways to treat stroke and the heart attack. Death of or damage to part of the heart muscle due to the insufficient blood supply to coronary artery are the arteries that are usually blocked. Bypass surgery or drug are the usual treatment. Okay. A slide about the thrombus. What is the thrombus? Blood clot on the vein, artery, or within the heart. And as you see this picture about the thrombus and embolus. What is the embolus? Blood clot that is carried through the body. Okay. And as you see this picture about the embolus. Okay. Thank you so much because pay attention to my conference. I hope that you like it. Please subscribe this channel, like this video, and write your comment. I'm waiting for your beautiful comment. Goodbye for now.